troubling trend is emerging. More children are facing life-threatening complications from the flu as vaccination rates drop, according to a recent CDC report. Christine Ware's voice shakes as she talks about the upcoming flu season, her anxiety palpable. "We're trying to figure out what life should look like without being trapped in a bubble," she says, reflecting the uncertainty many families feel. Her 4-year-old son, Beckett, has been recovering from a severe flu infection that left him lethargic, unable to move his head or arms, and even struggling to eat or speak. This isn't the first time Beckett has battled a rare but deadly condition called acute necrotizing encephalopathy, ANE, a brain inflammation caused by the flu. This time, his recovery has been slower than expected, a stark reminder of the risks involved. Ware, a parent from River Forest, Illinois, knows the stakes. She explains that Beckett's second diagnosis of ANE was linked to his lack of vaccination during the first episode. Research suggests that flu shots may be less effective for children who've already experienced flu-related brain inflammation, leaving them more vulnerable. The CDC's new data reveals a concerning rise in pediatric ANE cases, with 109 children diagnosed during the 2024-25 flu season, a record high. Of those, 84% had not received the flu vaccine, highlighting a critical gap in protection. But here's where it gets controversial. Some argue that the flu vaccine isn't a foolproof shield, especially for children who've already had flu-related illnesses. Yet experts like Dr. Buddy Creech stress that the vaccine is a vital tool for preventing severe outcomes. "It's a misnomer to think only sickly kids face complications," he says. "The flu can strike anyone, and the vaccine is our best defense." The data paints a sobering picture. Of the 109 children with influenza-associated encephalopathy, IAE, 74% were hospitalized, 54% required ventilators, and 19% died. These cases, though rare, underscore the flu's unpredictable danger. Dr. Molly Wilson Murphy, a pediatric neurologist, notes that while exact numbers are hard to pin down, the pattern of increased severity is undeniable. "Being on the ground, I saw this trend firsthand," she says. "The vaccine's role in prevention is clear. Last year, it was up to 78% effective in keeping children out of hospitals. Yet vaccination rates have plummeted, with only 49.2% of kids getting their flu shot in 2024. A sharp drop from 62.4% in 2019-20. Families face access issues, and clinics struggle with staffing, explains Dr. Sean O'Leary. It's a complex web of challenges. And this is the part most people miss. The flu isn't just a cold. It can cause brain swelling, seizures, and even death. For children like Beckett, whose body fights back slowly, the stakes are higher. "It's easy not to worry when it doesn't directly affect your family," says Ware, "but vaccination is a simple way to protect my son." So what's the solution? A call to action. The best way to protect yourself and your family is to get vaccinated, urges O'Leary. As the flu season looms, the question remains, will we take this threat seriously enough to act?